minimum 12 times during their pregnancy. Hospital-based monitoring or even GP-based monitoring is time-consuming, it's disruptive, and it's expensive. And our patients hate it. Many of my mothers are working mothers. If they need to come to the hospital in Cork, which is often 50, 60 or 70 miles away from where they live, that's a whole day. It costs €15 to park. By the time they wait for 3 hours in the antenatal clinic, their blood pressure is sky high. And so it's a false diagnosis. We frequently admit women to hospital with false diagnoses of query high blood pressure, only for it to settle the next day. But crucially, in low resource settings, like in some areas of Africa where I've worked, the rate limiting step here is actually access to a healthcare provider who can accurately measure the blood pressure. And this struck us as being completely bonkers in the 21st century, because now home blood pressure monitoring is actually widely available. You can walk out the door and go into the very first Boots and buy a very cheap monitor off the shelf to monitor your blood pressure. So why hasn't this been used for patients' advantage in pregnancy? Well, for a while there were no validated monitors, but there are now. There are cheap, robust, easy to use, validated monitors available that are accurate in pregnancy. And we have been trying to set up a system called LANIV, which is Irish for baby, but in our centre stands for Learning to Evaluate and Manage Antenatal Blood Pressure at Home. We know that pregnant women are young, they're highly motivated, and they're early adopters of innovation. Most of my patients map their pregnancy with apps. As they sit in the waiting room, they're looking at apps to tell them how far along their pregnancy is and to visualise what their baby looks like. Pregnancy is a teachable moment. Women are more likely to engage in a dialogue about their health in pregnancy than at no other time. And so using this very motivated, young, techie population is a very good way of actually developing a platform for home blood pressure monitoring that, once it works and is validated, could actually be then transposed to a more vulnerable group, such as an elderly population who may need to monitor another paradigm of their health in the home. Working with IBM, we're currently designing, developing and validating a framework which will communicate home blood pressure readings and other associated clinical risk factors to relevant healthcare providers. This is a fantastic innovation. It means that instead of coming into the hospital 12 times during the antenatal period, a woman can actually monitor her blood pressure at home, where it's much more likely to be accurate because she'll be relaxed and in her home environment. It will be transmitted via the cloud to my desk, and it means that instead of actually seeing and measuring 100 people's blood pressure, which will take most of the morning, I can actually just look at a display on my desktop and take about half an hour to go through all the blood pressure results. It's much more meaningful use of my time, it's much more economic, but above all, it's patient-focused and it's much more appropriate for a busy mum. So that's just a very short overview of what we do in infant. We're hopefully moving to a time when actually we'll empower women to monitor and manage their pregnancies through apps and using small mobile devices, as depicted in this picture here. But what we're really about is making sure that that happy day I talked about right at the beginning is a really happy day for everybody, and not just those in resource-appropriate settings. Thank you very much. Some low resource settings in Africa where we've done some work. One of the barriers is initially access to standard lines, telephone lines, ISDN lines. But that's not a problem anymore because 3G, 4G coverage in Africa is actually better than it is in Kerry, not far from where I live, which means that mobile phone technology is actually going to have a real impact in delivering healthcare to women in those settings. And that's one of the projects that we're currently developing, taking mobile phone technology, using apps for monitoring pregnancy outcomes and newborn health outcomes.
I guess for us really, one of the things I really wanted to do was to make sure that all the mums can use the technology at home or in the library, wherever they've got access to a computer, so all software, everything we use is free. So we use Google Drive and spreadsheets and stuff, because that's all free, so everything we use is free, so they don't have to pay for anything. So I think actually the biggest difficulty is actually getting them to do it, and showing them that they can do it rather than the tools not being there.